Welcome everybody at this week's Spark. Our theme today is subtle physical symptoms not to ignore. Delicia Baben is going to facilitate the session. Thank you, Delicia.
Good afternoon, all of you. One of the questions I'm asked most often is, when do I go to the doctor and what do I go to the doctor for? So I've tried to make a little list of the subtle symptoms that you need to look at, because some of it's obvious. If you have a sudden chest pain, if you have sudden loss of vision, if you have severe stomach pain, it sort of makes sense for you to go to the doctor. Also bearing in mind that this month is Cancer Awareness Month. So it's also a good topic to just look at your body, make sure you know what it's like when it's in a good state, so that you can pick up when there's something happening and you need to pay attention to it. So one of the first signs that people ignore is unexpected weight loss. Now, clearly, not something I'm ignoring. It's not happening. So, but they say more than 5% of your body mass lost in 12 months or less. Now, if you work out what 5% of your body mass is, it's not a large amount of weight for most people. It can be as little as 2 kilos. So if you have lost weight and you haven't been trying to lose weight, please don't ignore it. It can be a symptom of many different things. If you look at overactive thyroids, diabetes, liver disease, and then the big South African one, TB, and also different types of cancers can cause weight loss. And because it's something that most of us actually want, it's something that you can easily ignore. Then the next one that we look at, now I'm going to do this almost like a list. If there's more detail that you want on any of these, we can discuss it as a separate week, or you can ask me afterwards. So forgive me if I go a bit fast. The next one is a fever. So don't go to the doctor with every single fever that you get. But if you have a fever that persists and it lasts for more than 3 days, and it's 38 degrees Celsius or more, please pay attention to it. There's a lot of chronic diseases that's accompanied with a fever. Then shortness of breath, especially if it's unexplained, if it's sudden and it's severe. Don't go for a long walk and then go to the doctor because you can't breathe. This is if nothing has happened that can cause shortness of breath and suddenly you can't breathe. It can be a panic attack. So, but even if it is, please remember that then you need to address the anxiety. It's not normal not to be able to breathe. This can be caused by things like asthma, pneumonia, and the one quiet killer that we ignore very often is a pulmonary embolus. That's a blood clot that goes through the lung. And it can cause catastrophic damage to your lungs if you ignore it. It's easily managed, can be managed, you'll survive, but please get to the doctor fast. Then another interesting one, and this is something we don't want to talk about too much, is if your bowel habits change. Every person has a normal bowel habit. Some people go once a day, others go 4 times a day, others go once in 4 days. Whatever your normal is, if it changes and it persists and there's no reason, please have it seen too. Especially if the color of your stool dramatically changes, and black tarry stool is never a good sign. That shows that there's blood somewhere in the colon. Also persistent diarrhea or constipation. So not in 1 day, but if it carries on and it's now 4 or 5 days and it's not changing, go to the doctor. If you have stomach pain consistently, especially if it's not cramps. Cramps is normally almost a normal stomach pain, but if you have consistent pain, it's more likely to be something like Crohn's disease or an ulcer or something like that. So you can see that the symptom in itself is not the problem, but it shows you that something's happening in your body. If you see sudden flashes of light, now this one even I was not aware of, I did not know this. It can be a migraine. A lot of people present with a flash of light when they start getting migraine. If you are prone to migraines, you will know what your normal light flashing looks like. But if you have a sudden flash of light and you cannot see like you could see before, it could be that your retina is detaching and you need to get to a doctor very fast. If it's picked up early, you can prevent vision loss. If you ignore it, you can become blind in that eye. So just don't, that's not something you can sit on for 3 days, go immediately. Any wound that does not heal for a long period of time, they say, the literature talks about 3 months. 3 months to have a wound that's not healing is a very long time for most people. So if you have a wound that doesn't heal for about 3 months, or that heals but comes back in the same place, please make your doctor aware of this. This can show things such as diabetes, cancer again, and vascular disease very commonly presents with ulcers on your legs. Any sudden confusion or change in mental health. Now, often you won't be aware of this. Someone next to you will be aware of it. But it can be something as simple as suddenly you notice that you can't focus. You cannot get your mind to attach to any thought. It's like your thoughts are all over the place. You're suddenly unable to form words. So it feels like your tongue is thickened, or you have word finding difficulties. You can talk, but you cannot find the words to say. Or if suddenly you find yourself in a space where you don't know where you are. You're in a room and you don't know how you got there and you don't know where you are. Please immediately seek medical attention. This can be a stroke, it can be a seizure, it can even be a severe infection of your brain. Anything that affects your brain functioning immediately needs medical attention. The sooner you can get attention for it, the most likely you are to recover your function again. Please remember, it's not always a bad thing. It's not always catastrophic. Sometimes you're simply dehydrated, but make sure that you get the attention. Then also something that we read about a lot is chronic fatigue. Chronic fatigue is not when you're tired because you work too hard. Chronic fatigue is down to the bones of your body. You are so tired, it feels like your marrow in your bones are tired, and it doesn't go away from resting. This needs attention. It can be something like your blood pressure, especially high blood pressure gives you that if you're not medicating it. Or again, lots of your cancers present with this severe tiredness. It can also be chronic diseases such as, what did we call it, yuppie flu, that kind of thing. Your low immunity diseases all present with this. It can be managed. Then, because it's October, we have to mention any change in your breast or your nipples. And please don't think for 1 minute because you're a man, you cannot get breast cancer. The problem is men don't pay attention to it. They think the women will deal with the breast cancer. They will watch their testicles. Please, 1 in 800 men will get breast cancer. Most of those men will die. Most of them, and mostly because they don't pay attention to it. The stats for recovery is exactly the same if there's early intervention. So if you see any lump or dimple or redness, or your breast is suddenly itchy in one spot, please make your doctor aware. So the main message of all of this is, and Celine will confirm this from her wellness, what you call it, course, is know your body. Don't ignore anything because it's subtle. If it's there and it's consistent, please make sure that there's nothing that can be done for it. You can only live your best quality life if you look after your body. And there is help out there, you just need to ask.